Fixing an IV line is something that is usually taken as a serious procedure. It is a sterile procedure in as much as it looks simple and easy. It is a sterile procedure that should be approached and handled with care. So today I'm going to take you through various methods and styles of fixing an IV line. First of all, to begin with, you'll need an IV line itself. You need a tourniquet like this one, the pink one that we wrap around the hand. For a tourniquet, you can use a glove or a piece of cloth like this one, which is stretcher. You need a pair of gloves which are clean or sterile for that case, and you need a strapping, something to strap, something to hold the line into place. So first of all, you ensure that you swab or you wipe the place in whichever manner. Some people may prefer swabbing in a circular manner. Some people prefer thoroughly rubbing through the skin, but whichever way, just ensure you swab the skin gentle enough to avoid causing a bruise. So let's begin after you've seen those few pictures, and ensure that the patient is more comfortable and you have all your drugs ready, so that after you fix the line you don't have to struggle. So first of all, after you tie the strapping after you tie the tourniquet. A tourniquet is something that you block the blood vessel from behind, so that the other part, blood vessel, swells up. They form a form of inflammation. So after you tie it back, you ensure that the blood vessel is more visible to you. After it's visible, you gently prick it through. You can access an IV line to collect a blood sample, as we can see here. You can access an IV line to put medicine, a direct IV injection, or an infusion. So whichever way, ensure that everything is ready, the tool that you're going to use. So after this is the strapping, this is the IV line that's being fixed over here. So as you can see, he has tied the tourniquet very well, and after you ensure you've accessed the line, remove the tourniquet. Remember, if you don't remove the tourniquet, you can always cause a gangrene or a very bad form of infection, because the blood vessel will swell and you'll end up getting some very bad sepsis. Remember, if you fix a line or you fix some medicine through an IV line that the tourniquet has not been removed. For example, our tourniquet here is the purple stuff that the doctor has tied above the IV line. Our patient is being withdrawn the blood. Now, if for example you are withdrawing blood or you are giving an IV medication and you have not removed the tourniquet, you're going to cause either a gangrene, an infection, an inflammation, swelling, all that, which is very harmful to the patient, and it can bring very serious health hazards. Now, after you've done your tourniquet, you swab and then you gently put the line, as we can see in our picture here. The IV line has some parts. There's an introducer with a needle in between, and something like a flap or a valve. So when you fix the line, there's a space there, you'll see the blood back flowing. That's when you'll know that you're inside the line. Other than that, just ensure that you access a more visible blood vessel, and ensure you secure the line with a good strapping. And in case you cause a tissue damage, or you put the IV line in a wrong way, apologize to the patient, and you can apply some ice pack on top of the line. Remember, it's not a must we are putting an IV line. You can even be doing direct IV injection. So this is the correct way to do an IV injection, this way. Ensure you put it slowly in a slanting manner. Do not be shaky. In case you realize you are shaky, just relax, talk to the patient, and you fix it that way. Ensure that your drugs are more ready, and ensure that you dispose your sharps in a correct manner, and you hold your medications and you hold your IV lines in a place that you are not going to cause more health hazard. Wear gloves, unlike our client here, wear gloves to protect yourself and the patient. Thank you, and for more procedures, kindly subscribe and we'll teach each other more. Thank you so much.